It's that time of the year again. The winter seems to be creeping in. Delhi's air quality has once again plunged into the danger zone, with pollution levels across key areas reaching poor to very poor categories. At Anand Vihar, for example, let's pull up those graphics for you. AQI hit a hazardous 366, while Dwarka Sector 88 Sector 8 actually recorded 326, both marked very poor, posing serious health risks as well to people. Central parts of the city, which we think are greener, no better. Major Dhyan Chand Stadium and Chandni Chowk saw AQI reading of 286, 276 respectively over there. Again, poor category there. The air quality in RK Puram and ITO, well, that's said to be the hub. A lot of traffic there as well. No better, remain to be in the poor category. And what's the story here? The story is that this is the state of affairs even before we have hit Diwali, even before we have started taking into account stubble burning from neighboring states. Imagine none of that has started and we are already in the poor to very poor category. And it's set to get worse. Why? Because remember, on Wednesday, the Supreme Court gave a green signal to green crackers. Experts have warned that after Diwali, the AQI is going to worsen and sustained exposure to such toxic air can lead to breathing and health issues. So, what are we doing on the program today? We are discussing Delhi's perennial pollution problem. Is there a pollution ka solution available? And what is it that you and I can do as citizens to bring in some level of impact? Here on India Today on 5 Live, we are doing a doctor's roundtable to make sure that you are aware, to help you understand the problem of pollution, and also to understand, if you're not convinced so far, why you should care about pollution. I'm very happy to have an expert panel joining me now, and it is spread across categories to really give us a full 360 view. We have with us Dr. Nihar Parekh. He's a pediatrician, director of Cheers Child Care. So it'll be very lovely to understand what pollution is doing to kids. Then we have Dr. Vivek Nangia. He's a pulmonologist. What is pollution doing to our hearts? We have Dr. Vimlesh Dharpande. He's the director at rheumatology at Fortis Hospital in Noida. There is a recent study that has said that pollution is actually linked to arthritis as well, which is what I want to really get into and understand from him. And then we have Dr. Balbir Singh. He is the chair and head of cardiology, Max Healthcare. He's a Padma Shri awardee as well, to tell you how pollution impacts your heart. Let me give the first word to Dr. Balbir Singh. Dr. Balbir Singh, we've been tracking air pollution year after year. For me, the change that has come in has been the fact that though we are more aware, we don't seem to be seeing more sort of solutions. There is no pollution ka solution on the ground just yet. The baseline pollution level is what I'm talking about. Because overall, we see farm fires go down. We see farmers finally being aided with the right solutions. But how exactly is it that even this very poor category of pollution level and this AQI is doing to us? Let me take that question to Dr. Vivek Nangia first then. Dr. Nangia, we've seen you write report after report. We've seen doctors talk about how lungs of even young kids are turning black. But there are still some who feel that air pollution is not the problem, that our body will adapt in some way, some weird explanation that I keep hearing from people. What is the clinical advice that you are giving your patients?
So, Sonal, basically, first we need to understand that what all harms can air pollution do to our lungs, and not just the lungs, but the entire health of the entire human body. You know, the effect is not just restricted to the lungs. When you have a larger particulate matter, like 10 microns and all, 10 microns and above, that usually gets filtered at the nasal level itself, and all it can cause is some kind of an burning in the eyes, irritation, nasal congestion. A particle size between 5 to 10 would get stopped in the upper airways. So there it would usually cause cough, irritation. But a particle size less than 2.5 microns goes right into the lungs, triggers off an inflammatory cascade, which then impacts the entire body. That includes the brain, the heart, kidneys, liver, all organs of the body. And in fact, even predisposed to certain hematological cancers as well. So if we enumerate the various systems and the various diseases it can cause, starting from the brain, it can cause brain strokes, brain attacks, heart strokes, heart attacks. Similarly, asthma, chronic obstructive pulmonary diseases, hypersensitivity pneumonitis, lung cancer. Lung cancer is becoming increasingly common in the younger non-smokers. Conventionally it was considered to be a cancer of the smokers, but now as we see in non-smokers, it is more common, probably because of the air pollution around us only. And this impact is
Right.
also in pregnant ladies, especially when they're carrying a child in the womb. The child itself, even before even before being born, can be impacted with a slow development of the lungs, poor immune system, intrauterine growth retardation, and so many other complications. And as the child starts to grow, they start developing allergies, more frequent respiratory tract infections, and in fact, some pollutants can even result in mental retardation in the children. So the impact of air pollution is far and wide. If you see, there are studies which have actually shown that our lifespans have gone down by anything between 2 to 12 years. The average expected lifespans in people who are being exposed to this kind of an air pollution.
Right.
So I guess,
Dr. Nangia, you talked about kids, which brings me to Dr. Nihar Parekh there, and I want to understand this. Dr. Parekh, we've spoken, like I said, year after year about how many kids are actually coming in with faults, or how many of them are coming in with, their body parts not functioning properly, and everything in some form or the other related to environment, related to pollution. I want a very specific answer to how much level of pollution starts impacting you immediately. Because, while we are showing the Delhi numbers right now, Bombay is no better. Mumbai, Bangalore, any metro is not better. In fact, I would go ahead to say that even tier 2 cities now, places like Kanpur and Lucknow are also getting worse because there seems to be no understanding of this problem in the first place. So at what level of AQI would you say now it's dangerous? Pack your bags and probably take a pollucation.
I mean, it's a round the year phenomena, especially, but during the winters, you will have to have a vacation for more than 3 to 6 months because this is not going to get better. It gets worse year after year, year after year. The minute there is smog in the air, above AQI going above 140, 150, it is directly proportional to the kids walking into our clinic, the number of nebulizers prescribed, the number of inhalers started, the number of antibiotics for an infective cough, secondary to an allergic cough, is just exponentially and we see it the next day. The minute we see the clear skies turning into gray skies, the minute we look out of our work windows and we can't see buildings down the road, we know next day is going to be loaded with this. And this doesn't get better. As the winter sets in, as the firecrackers are, they set ablaze, and those in the north you have the crops being burnt, is just going to get worse. I have not seen clear blue skies for winter, at least in the last 3 to 4 years. COVID was probably the last time we had brilliant
Yes, I was
AQI.
just going to point out, yeah.
After that, I don't think it's going to get better. So
Dr.
the
Balbir
minute you hear
Singh.
100 plus,
Yeah, let me bring in Dr. Balbir Singh. Dr. Singh, there are still those who are not convinced. There are still those who are going to the Supreme Court to say, allow crackers, make it green. There are still those who are saying, ab to ye har saal hi hota hai. They've given up. They're saying, we can't sanitize every place. How long will we keep our kids inside the houses, not send them to school? To those people, do you have an argument? Do you have a way to explain why we should care about pollution? Why should we be very, very worried?
So I'm a cardiologist, so I can tell you that we always think pollution affecting the lungs. What we forget is that the commonest cause of death due to pollution is heart, not the lung. And why does pollution cause death? Because sets up an inflammatory reaction by those small particles that can come into the lungs. They set up an inflammation. Body says, I'm struggling to fight against a small particle which is not mine, so it has a cascade. It attacks that with inflammation. That inflammation hits the vessels which supply blood to the heart. This leads to heart attacks. So this is something very silent, and people won't understand how pollution is causing a heart attack, because it is very simple to understand that it goes to the lung, so you need bronchospasm, so they think nebulizer is a solution. But what they don't understand is that it is reducing their lifespan, it is reducing mortality, and heart is a silent killer. It can cause a severe heart attack, and we know the London pollution, the first one happened, the heart attacks rose tremendously, and there were more deaths due to heart attacks than to lung problems. So we have to understand that this heart problem is a silent problem, and pollutants add to the fire. So it is like smoking. So if we say that please don't smoke, we also say that there'll be less pollution. So how do we compare? So people have to understand that it is not just cough, it is just not nebulizer which is going to help you. It is an increased risk of heart attacks and brain strokes both.
Got it. Got it. You know, I'm not surprised that you're saying it. We all know internally the story and how it is connected to air pollution. What really baffles me is that there are so many who are still not convinced. Which brings me to Dr. Vimlesh Dhar now. Dr. Dhar, you know, year after year, as the air pollution problem is escalating, we are truly now understanding the extent to which it can go and the extent to which it can cause a problem as well. So you did a study very recently that linked air pollution to arthritis. Please take a moment to explain to our viewers how exactly is air pollution linked to arthritis.
Thank you for having me here at India Today. So at outset, I'll put few facts which are known to us about arthritis. It affects young population, mostly women, and in the best age group, that is between 20 to 40. So there is a genetic and a hormonal link known to us. There was already a study available to us which says that smoking increases arthritis. So Western population where ladies did have much more smoking, there was a higher incidence of rheumatoid arthritis. So what was in India which was not linked to smoking? So that was a study which highlighted the particulate matter of 2.5. PM 2.5 was the component which was linked to our study, which highlights that pollution aggravates your arthritis. So we know we have a gene and a hormonal stress factor which contributes to arthritis. But what was a catalyst or what was triggering it was the particulate matter in our society, in our population, in our country. Now, what happens when you take this study and go to the rural area? You will find a stark difference. People who were in and around the main arterial roads of our larger cities had the worst type of arthritis compared to the rural areas. So even if I have a gene and I'm in the same vulnerable population, but I'm away from pollution, I have a lesser amount of arthritis. Let us do the other way around. If I say that there is a power plant, say Dadri, so what is the incidence of arthritis in and around Dadri versus if I go to a hinterland where the same population is supposedly there, surviving there or living there. They actually have a lesser. So that exactly means that what we knew, how smoking affects us in terms of autoimmune disease, is similar how the pollution affects us, our immune system. It creates a havoc in our immune system, leading to increased incidence of arthritis. And that requires a course correction. And that requires awareness about pollution and linked to arthritis.
All right, you've heard opening comments, viewers, from all the doctors, and all of them agree and tell you that it's a problem. All of them are saying the same thing, that we are not even understanding how not just bringing down your quality of life, it's actually leading to disasters in some place. So the question is really simple then. Dr. Nangia, then how are we to deal with this? What was your reaction to green crackers, for example, being allowed by the Supreme Court?
Okay, so green crackers have been shown to reduce the emission by about 25 to 30%. But we still need to remember that there is still some emission that is happening, you know, especially firecrackers like Phuljhadi, Anar, Ladi, Samp, you know, they all, and the Charkhi, they all emit almost 200 to 2000 times higher particulate matter that has ever been allowed by the WHO limits. So that is the limit, and then if it is a reduction by 25-30%, how much are we really going to benefit from it? And let's not forget that it is not just the higher concentration, but just an exposure to the air pollution for somebody who's vulnerable. And when I say vulnerable, it actually means that children less than 5 years of age, elderly more than 60 years of age, and those who have any kind of comorbidity like a heart disease, lung disease, kidney disease, any kind of immunocompromised state, they would all be prone to developing complications because of the air pollution, even if there's a 25-30% reduction. But yeah, again, you feel that, okay, something is better than nothing. At least we still have some degree of reduction in the air pollution levels with the use of green crackers. But not that they would be 100% and 100% not being effective on our lungs.
Yeah. Dr. Balbir Singh, I mean, all of you in this question, please take it up, whoever wants to as well. Dr. Balbir Singh, you have such high-profile patients. You have politicians and celebrities come to you. This is one problem which is an equalizer. It impacts everybody. The beggar on the road to the one who is driving an Audi or a Porsche, right? It impacts everyone. Why is it that we have failed to take it up as a campaign? Why is it that our politicians are just not realizing the issue just yet? They are going to the court to say, allow it, it's tradition.
So I would think that they have not understood the problem well enough. They think pollution causes some cough or some visibility problems, nothing beyond that. They have not understood that it can lead to serious impacts on the vascular system and decrease the longevity. Over a period of time, pollution every year is going to reduce the number of years that we live in. It is going to increase the number of heart attacks. Now, this has not been understood well by these politicians or these high people. And they feel pollution is just cough and a nebulizer may help or putting a mask may help, which it doesn't. And that is the major concern that this has not impacted. So, problem like stub burning should have been tackled much well in time. It's not that they cannot be tackled. They should be tackled with a tough hand. Only then they will happen. As a doctor sitting here, I can just reiterate that the problems of pollution are many. I can just suggest to them that it is time that we all work together and get this problem, or a solution to this problem, where there are many solutions which they are best at finding.
Well, talking about it, I think there has been some substantial work. There has been some work done in Punjab and Haryana on stubble burning. This year, anyways, because of the floods, we will not see perhaps so many farm fires happen as well. But what we are looking at is a baseline pollution in the metros, which seems to be up all year round, only to be getting to an unlivable condition during the winters. But Dr. Parekh, Dr. Balbir Singh mentioned a very interesting bit about wearing a mask, etc. When it comes to kids, you can't even do that. Kids below 3, correct me if I'm wrong, can't even wear a mask. So what are we to do? When I go to my pediatrician, he'll tell me, Delhi is no place to live, pack your bags, go to the hills. When I was dressing up for this show, my makeup person just told me कि मैम अगले हफ्ते से मैं नहीं रहूँगा, मुझे asthma है, मुझे डॉक्टर ने बोला है, city छोड़ के जाना है. That's the reality of our times.
Yeah, so the thing is, it's so true and it's so unfortunate that we see our children grow up like this. We see kids right from the day they're born, right in front of us, go through this entire rigmarole of getting coughs, nebulizer, irrespective of the father or being an asthmatic, yes or no. Initially, genetics used to play a role. That if father and mother are asthmatic, chances of the child requiring nebulizers, frequent line inhalers later were higher. But that's not the case anymore. It's the air quality that determines their respiratory growth, frequent medications, nebulizers, like you rightly said, no masks under 2 and 3 years of age. So they just have to go. So the only thing you can do, and the take-home message for the parents is try and at least improve the air quality at home. I have a lot of parents who say, what is the advantage, even when they step out? But even at least some part of the day, 40 to 50% of the child's day is spent at home, maybe more, but definitely not less. So trying to improve the quality of air at home itself is a start. Getting a good air purifier, maybe getting rid of dust collectors, especially in the room they're sleeping in, like for example, rolling up the carpets, locking up the soft toys, getting rid of bird feeders in and around the house, which are known to contribute, sunning the mattress, getting dust mite resistant mattress covers, duvet covers. So these are things that you can do as a parent to at least try and help a little, as long as the child is inside the house.